All right, diving into a critical care challenge today, one that's more common than folks might think. Weaning patients off mechanical ventilation.
Yeah,
You'd figure, okay, lungs are better, breathe in, tubes out, but it's not that simple for a good chunk of patients.
it really isn't. 20 to 30% they hit this wall.
Mm.
And what's wild is it's rarely just the lungs themselves.
Oh, interesting.
The detective work, got to use a checklist, be thorough, airway, brain, heart, even hormones get involved.
So we're talking whole body situation here, and having that checklist, I bet that's vital for, say, residents prepping for rounds, something like that.
Totally. Can't miss a thing. Take airway and lung function seems basic, but your research dug into some really specific stuff there.
Right, like that study used endotracheal tubes.
Right, yeah.
Way more resistance compared to fresh ones.
Huge.
Seems obvious, but seeing the numbers, how much harder it is to breathe,
Exactly.
that hits home. These little things matter.
Totally. It's like that tiny bit of extra resistance for someone already struggling, it's a mountain for them to overcome. And then on top of that, toss in COPD, ARDS.
Oh, yeah, that's going to complicate things.
Absolutely. It's not just getting air in anymore. It's how easily the lungs inflate, gas exchange, the whole system's affected. That changes how we think about tracheostomies, bronchoscopies, everything.
So, keeping that delicate balance in mind, let's go down our detective's checklist here. And this one I never would have thought of in the ICU, the brain.
Right.
This connection between weaning and what seems like, I don't know, psychiatry almost.
Delirium, man. Way more common than we used to think. And its impact on weaning is huge.
Yeah.
There was a study found impaired cognitive function, delirium-related. It made extubation failure 4 times more likely.
4 times.
Yeah.
That's not just a side effect.
No.
That's a core issue then. But it's not always like full-blown delirium, right? What about anxiety? Someone who's just not sleeping well, that's got to factor into.
For sure. Think about it. You're panicked. Body's in fight or flight mode, not let's chill and breathe mode.
Right.
Then you layer on exhaustion, no sleep, common in the ICU. It's uphill from there.
Bleak picture, but I'm hoping there are ways to manage this, right? We're not just...
Oh, absolutely. So early on, we got to assess tools like the CAM ICU can help spot delirium. And if it's anxiety or sedation practices, got to be super careful there. Recognizing the mental burden, treating it just as urgently as the physical stuff.
It's all so interconnected. And speaking of connections, we've done lungs, brain, but the heart's got to be in this mix somewhere too, right?
It's like, picture this. You're asking someone to run a marathon after being stuck in bed for weeks.
Oh, wow.
That's the kind of demand we put on the heart when we're weaning someone off the vent. Huge physiological effort.
Yeah, and obviously if there's already a heart condition, that throws a whole other wrench in the works.
Absolutely, yeah. But even in patients with no history of heart problems, studies show their heart's pumping ability, like the left ventricle ejection fraction, it takes a dip during weaning, especially with COPD.
So COPD, they're already working harder to breathe, and now their heart's got to pump harder too.
Exactly. It's this vicious cycle. And then factor in edema, which often comes with lung problems, that strains the heart even more.
Seeing all those connections in our little checklist play out.
Right.
So beyond just observing them, are there ways to really measure how much strain the heart's under?
Oh, yeah. We can actually look at levels of a hormone called BNP, brain natriuretic peptide. It's released when basically the heart muscle's getting stretched too thin.
So higher BNP, the heart's working overtime.
Exactly. Gives us an objective measure of the strain, not just, oh, they look a little tired.
Fascinating stuff. Okay, so we've covered airway, brain, and heart. What about the diaphragm? Where does that fit into this whole puzzle?
The diaphragm, it's like the unsung hero of breathing, right?
Okay.
And just like any muscle, if you don't use it, you lose it.
Right. Makes sense. We all know that feeling. But I imagine being on a ventilator for a while, that's like the ultimate not using it.
Exactly. There was this one study found that after just a month on a ventilator, diaphragm strength was only 35% of normal.
Wow. That much weaker.
It's a huge drop.
So is it purely a muscle weakness thing, or is it also fatigue playing a role?
That's actually a debate. Some researchers think it's mainly the weakness from not using it. Others say it's the fatigue of those first efforts to breathe again. Probably a bit of both.
Makes it trickier to treat, I'd imagine.
Right.
What are some of the, the promising treatments being looked at for this diaphragm dysfunction?
So a couple of things seem promising. Inspiratory muscle training, where patients basically breathe against resistance, seems to help strengthen things up. And then there's research into antioxidants, like alpha-tocopherol and ascorbic acid might help too.
Okay, so some hope on the horizon, even if more research is needed. But we've still got one more stop on our detective's checklist here. And this one, I'll admit I wouldn't have immediately connected to weaning, the endocrine system.
Right.
Hormones, the whole deal.
It's often overlooked, but it can be a major player. Take adrenal insufficiency, for example.
Adrenal insufficiency. Now, that's not something I would put together.
Yeah, it's not intuitive, but studies have found that adrenal insufficiency can actually make it tougher for someone to get off the ventilator.
So, like, if your cortisol's low, that stress hormone, that can mess with weaning.
Wild. It is, but it shows you how these systems, they're all talking to each other. And that gives us ideas for treatment. There was a study giving cortisol to patients with adrenal insufficiency. It actually shortened their time on the ventilator.
See, now that's what I'm talking about. Finding that missing puzzle piece, suddenly things click.
Any other endocrine things we should keep on our radar with this?
Oh, yeah, for sure. Hypothyroidism, for one, can really tank a patient's drive to breathe, weakens those respiratory muscles,
Makes sense.
makes weaning way harder.
Like everything's working against you and your thyroid's out of whack. And what about nutrition? If someone's been really sick, that's got to play a role too, right?
Huge. Malnutrition hits your muscles hard, diaphragm included.
Right.
And we know how important that is for weaning. Electrolytes, too, though I won't go down that rabbit hole right now. They're key for muscle function as well. Feels like we've uncovered this whole cascade of potential problems. With all this to consider, I can really see why treating everyone the same just won't cut it.
100%. One size fits all. Not in this game. It's about catching these challenges early, tailoring the treatment plan. That's how we get people breathing on their own again. Remember that detective's checklist we talked about?
How could I forget? Airway, brain, heart, diaphragm, endocrine system. It's not just medical jargon anymore. It's like a roadmap.
That's it. Each piece gives you clues, helps you see the big picture, what this patient needs to breathe freely again.
So to our listeners out there, picture yourself, checklist in hand. Next time you've got a tough weaning case, think about all this. The airway, the brain, the heart capacity, how strong that diaphragm is, and yeah, even the hormones, they matter more than we think.
It's about connecting the dots, realizing even the little things. They have a huge impact. And honestly, that's what makes this whole field so challenging, but also so rewarding.
Because we're not just treating lungs or hearts or diaphragms, we're treating the whole person, their unique situation, their struggles. That's what it's all about.
Couldn't have said it better myself.